How do you fix animation deformity with breast implants? Well, the easiest way is to remove the breast implants, but some patients aren't ready for explant surgery. And this patient is one such patient. She had a lot of breast pain, she had capsular contracture, the implant was very high under the muscle and causing her a lot of pain. So we removed that implant from below the muscle and placed it on top of the muscle in a new pocket. Using newer implants, there's less risk for rippling, so it is more successful these days to do that. And it does often solve the problem of pain. Any breast implant can cause pain, but typically they're less painful above the muscle. And this is another patient with a similar problem. She had a lot of breast implant pain and was not ready to give up her breast implants. So we exchanged them and went above the muscle, and that helped solve her pain and gave her what I think is a more natural appearance. And this patient as well, you can see she had really bad animation deformity, and replacing the implant, again, going above the muscle, really helped with both her pain and her animation problems. And again, this patient wasn't ready to remove her implants. She could not accept the aesthetic sequela that potentially could occur. So exchanging the implants into a new plane above the muscle a lot of times can help solve these issues for a patient that's not ready for implant removal.